Welcome students. This is a short video for your exam, that is INICET May 2023 tomorrow. Wish you all the best for the exam and let us see how to attempt it nicely to get a great seat and a great rank in tomorrow's exam. To start with, how to attempt, let us know the paper of INICET, which you all are aware of, 200 MCQs plus 1 you get for every correct answer, minus 1 by 3 instead of 1 by 4 like NEET. You will get minus 1 by 3 for every wrong answer and 0 for your not attempt of the question. Now the question is, INI is an exam which is more of, you can say, test of how much strength you carry mentally on the day of exam rather than your overall preparation. Why I am using the word strength is everybody is almost equally prepared for the May one. You all have been passing through the NEET cycle, and most of you are, like, you can say, sailing in the same boat of preparation. Yes, there are few candidates who are having edge of, you can say, preparation by doing the extra hard work, the extra papers, whatever you have done in last 2 months post the NEET result. So let us see how does it make a difference when it comes to attempt for all those who get a rank and all those who fail to get a good rank. Okay, try understand this is an exam with a limited seat, so there is very less scope of error, there is very less margin of error like NEET. In NEET you could have done 20% mistakes and still you manage with a government rank, but not like INICET. INICET will test your both like knowledge, patience and mental ability on the day of exam, how smart you are in terms of attempt of the paper. I'll tell you a very simple logic. Since the exam is a very limited seat exam, you have to go for higher attempt. Now, how high is like really a relative term. So let us categorize into one, two, or three options. The first option is you go really high score, you really high attempt. That I would say you attempt more than 190. Okay. More than 190 is like when you are feeling the paper is too easy for you. You have read almost everything which is there on that paper today, and ultimately it's your day. That is a golden sign when the things moving in your favor. Simply do whatever suits you best. If you are able to attempt more than 190, stop anywhere you want after that. That is your golden day. Actually, you should cash it on. Yes, there had been cases of rankers, top rankers, even the rankers in say 5 to 10 or 10 to 15 rank slots who have attempted more than 190. So what I'm talking today is pure statistical data. It's not assumption. It's not, you can say, some random figures we'll discuss about. But yes, if you are not able to attempt 190 in like smooth passage of the time, then don't end up attempting 190 plus. Okay. Then second situation is you should attempt anywhere above 180. Okay, 180 is like 90% of the paper. If you are say starting from round 1, you keep on attempting questions and you are comfortably going 150 plus, it means the paper is well balanced for you. Forget about rest of the world. Paper is favorable for you. You should go and attempt 180. How to do that, I will just discuss in a while, but make sure you don't attempt less than 180. Third possibility is paper is really tough. Very rare, but yes, it is a possibility. It goes really tough. And in that situation, what you have to do is still try above 175. Okay, less than 175, you are making a suicide. Or you can say worst case scenario, if the paper is say out of the blue, 20-30 questions are really tough. Last I would say is just manage to be above 170. But yes, that is a, like, if you have a bad day, maybe it's like paper is easy but you are not able to comprehend that, then that is the cases. All those attempting less than 175 or less than 170, you should not really think of a like rank in INICET, because it is like in India you will get at least 10-20 students who are prepared to that level. Okay, so now comes how to attempt such a big. I've given you three scenarios. Paper is very easy for you. You go and attempt anything above 180, 185, 190. Paper is average, you are going on track, it is working fine, attempt above 180. Worst is 170. Now the paper will have two kinds of questions. One is direct questions, basically the ones which you call it easy, and third is indirect questions, like you call clinical questions, you call tough questions, maybe some images will be here also. Okay, direct questions, keep on marking, don't overthink, don't look for negativity in the paper. Don't just try to find out why the examiner is asking such an easy question. Yes, it's an easy because you have read it. It's not easy for everybody, it's not easy for me. Okay, but it's easy for you because you are well prepared for the day of exam. Now clinical questions are challenging, especially when it comes to INI. Clinical can have two different scenarios because it's a clinical. Two different scenarios, I mean clinical can have two different answers, right? One answer according to what you have studied, one answer what is going on the research in AIMS, PGI or CHIPMER, the three colleges of INICET. That places, it's like nobody can do, you can say, gamble on that. Nobody can vouch what will be fitting into the situation. But yes, whatever suits you best, attempt it. Okay, whatever suits you best, attempt it. Don't just overthink on the situations. Don't go for rare possibilities. Please remember this line for tomorrow. Okay, if suppose there is a case scenario they have given, they want you to identify the disorder or give you the treatment plan for the disorder. Don't think of the rarest of the disorders in that chapter, in that segment, in that subject. Think on the common possibilities. Think on the situations which are more commonly asked, like more common lesions and more common predictable factors. Think which is about the situations which are more logical. Okay, don't think of random anything which you haven't heard of just because you feel you are able to eliminate two options does not mean you choose the rarest of the option as the answer. Okay, so don't go for rare possibilities. If you are stuck up in clinical situation, most commonly, most oftenly the clinical situation will be answer from the, you can say, the most common case scenarios. It will not be the toughest question. One or two might be there, but usually it won't be the toughest situation you have ever heard of. Okay, remember, if the question is really tough, it is tough for everybody, and if the question is making sense, it is making sense to everybody, so the answer has to be more sensible, right? Now, since aim scoring has to be high, even in any question you are able to strike off one option. It means three options you are still struck. I would suggest you should take a chance if you have to cross the barrier of number of attempts. But if your number of attempts has already been normal, say you have touched 179, 180, 181, then stop taking such gambles. But yes, if your number is 150, 60 and you have to push through 170, 175 plus, then such questions still you can take a chance. Where you should take chance or where you should take, you can say, attempt is like the questions whose topics are known to you. Okay, don't make a guesswork in the topics you don't know. You don't even know the ABCD of a topic. Never attempt such a question. Leave those questions. You have ample space, ample freedom. Like I'm giving you freedom to leave around 15, 20 questions very easily. So identify those and then leave it. Okay, don't just try to be like, if your paper is not going as smoothly as predictable according to you, maybe you are say just able to manage to 180, don't unnecessarily push it to 190. Again, I'm repeating. Okay, now what to do today, like last few hours, say you have 4 5 hours left for today. After you see this video, what I would suggest you is revise as many SR ship papers as possible which we have uploaded for you in BDS-2-MDS app. Okay, you all have access to those. You have access to the latest one papers also. Revise questions, read the question, understand it, revise the answer. That's all. So all the best for you all for the paper tomorrow for INICET. and wish you loads of luck and wish you loads of success for tomorrow. Have a great day.